Dear students, you are welcome to this lecture. My name is Kiden Robina. Today we are going to look at infertility as part of our gynecological topics. So infertility refers to inability to achieve conception after 1 year of normal intercourse at least twice a week. Then we have another term which is also known as sterility. Sterility refers to the absolute inability to conceive, whereas infertility can be reversed. Sterility may not be able to be reversed. So types of infertility include primary infertility. Here, no conception has ever occurred ever since the person was born. Then we have secondary infertility. Here, conception has occurred but do not result in a viable pregnancy. Causes of infertility they are grouped into general, female, and male factors. So, general factors include age. Women, fertility peaks in late teens and the early 20s and declines after 30. So at the teen ages and also in the early 20s, the chances of someone conceiving are very high. But when the person reaches 30, the chances start to decline. Then for men, spermatogenesis starts at puberty and continues through life, but fertility declines with age. Health and nutrition. Good nutrition supports fertility. Anorexia nervosa and obesity can lead to ovulation issues. Chronic alcoholism or drug addiction, morphine and similar substances depress ovarian activity. Psychological factors, anxiety and tension can impair fertility. Now let's look at the female factors. Congenital conditions. Here we have Mullerian agenesis. This one refers to the absence of uterus and the ovaries when those two are not there. Then we have vaginal atresia. This refers to the narrowing or absence of the vagina. Then stenosis of the vagina. Then the other factor is infections, tubal blockage from gonorrhea, chlamydia, tuberculosis, and the other infections. Endocrine malfunction, pituitary adenoma with increased prolactin levels, hormonal imbalances causing endometrial hyperplasia, hypothyroidism, chronic illness, poorly managed diabetes mellitus can be one of the examples, but there can be other chronic illnesses that if mismanaged can also lead to infertility. Then uterine fibroids, large fibroids distorting the uterine capacity, meaning cavity, and blocking the fallopian tubes, making the person unable to conceive. Cervical hostility, unreceptive cervical mucus to sperm, kind of cervical mucus that can kill the sperms. Then cervical incompetence leads to mid-trimester abortion and secondary infertility. The other one is endometriosis. Issues like menorrhagia, which is heavy bleedings, can also lead to infertility. Male factors. congenital conditions such as hypospadias, abnormal urethral opening, descendant tests when the testicles are not descended into the sac. Then infections which can lead to blockage of the vas deferens due to gonorrhea or mumps. Autoimmune issues, sperm attacked by antibodies from hostile cervical mucus, then leading to death of the sperms. Impotence, lack of erection for unknown reasons, ignorance of coitus, inadequate understanding of sexual intercourse. The person is not aware of what he is supposed to do. Sperm issues, lower sperm count, oligospermia, absence of sperm, azoospermia, all this can lead to infertility. Then endocrine disorders, pituitary failure, adrenal hyperplasia, or thyroid deficiency. So management, how can infertility be managed? Purpose investigation based on general reproductive history. Clinical examination of each partner separately is very important, and the information from each partner remains also confidential. Clinical examination assess size and the consistency of tests and the epididymis. Check for varicocele, hernia, or prostate gland size. Then semen analysis. Abstain from sex for 3 to 5 days. Analyze within 30 minutes of collection to ensure that they are still viable. Semen analysis parameters. Color. The color is normally cream white and viscous. Turbid indicates infection in case it is turbid. Bacteriology, rule out pus cells. Motility, progressive, sluggish, or no movement. Morphology is ideal if 50%, but if it's less than 50%, then there is a problem. Sperm count, the normal one is 40 to 370 million per male. Acceptable in Kenya is 20 million per male. Then volume, 3 to 70 mils. Female investigations focus on endocrine abnormalities. Routine pelvic examination, history considerations, illnesses like peritonitis or tuberculosis, menstrual irregularities, previous pregnancy outcomes is also very, very important. Specific tests that can be done to a female can include HSG, which is hysterosalpingography, which is HSG, laparoscopy with dye test, ultrasound for follicular growth. Ovulation confirmation methods, temperature method, cervical mucus method, progesterone blood test, which can be done on day 12 of the 28th day cycle. Ultrasound, histological examination of endometrium, also very important. Specific treatments for women. bromocriptine 2.5 milligrams can also be given for 1 month. Then tubal blockage treatments, salpingolysis, which is removal of adhesions that are in the tubes. Salpingotomy, creating an opening in the tube. Then tubal anastomosis. All this can also be done when here deemed necessary. In vitro fertilization, IVF, fertilization outside the body. The egg or the ovum and the sperm of the man can be collected and they are fertilized the outside of the body if the environment of the uterus is not favorable. Specific treatments for men, antecedent tests, early correction is very, very important. Azoospermia treatments, human menopausal gonadotrophin, which is HMG, synthetic androgens can also be conducted. Then oligospermia, encourage exercise and a good diet, avoid excessive alcohol, tobacco, and caffeine. Specific treatments for men continued. Lifestyle advice, avoid excessive coitus, maintain healthy weight, avoid prolonged heat exposure. Artificial insemination, for cases of impotence or hypospadias, can be done. Partner's semen also is the one to be used in this case unless the person has no partner. Impact on individuals and relationships. Social and psychological issues, which include poor social standing, psychological distress, dysmenorrhea leading to poor economic output, morbidity, dyspareunia, and sexual disinterest. Domestic challenges. These include domestic disharmony, separation, and divorce because people will not be in good terms, especially here in the African setting. Health and behavioral concerns, promiscuity resulting in HIV or AIDS and STIs because the person will be trying to get a child from outside the marriage. Associated uterine fibroids. So that marks the end of our lecture today. Thank you for being part of it.